not least. My name is Michaela Carroll, and I'm here testifying on behalf of Rhode Island Kids Count and the Right from the Start campaign, which is a state policy coalition led by 8 organizations to advance state policies and budget priorities that help babies and young children get off to the right start. Rhode Island Kids Count and the Right from the Start campaign strongly support the governor's proposed budget Article 5, Section 6, which would create a new tax bracket. You've heard a lot about what it would do. For the past few years, Rhode Island Kids Count and the Right from the Start campaign have supported strategies to increase revenue to meet the needs of our state's children and families. We've heard a lot of testimony about small businesses and working hard, but we know that the slashing of federal funds and elimination of critical federal programs make it difficult for Rhode Island families to meet their basic needs. And who's going to suffer from that? Children. Rhode Island will need to generate an estimated $70 million to maintain the programs that help children eat, parents work, and families have warm and safe homes. We're thrilled that the governor responded to the Right from the Start campaign's request that was signed onto by almost 50 organizations to consider a tax on ultra-high earners and generate state revenue to help families access affordable childcare and to backfill federal cuts to healthcare and food programs. All of these systems are our infrastructure. We also appreciate that he included important proposals in his budget to ensure families can continue to have access to SNAP and healthcare, as well as a new refundable state child tax credit. Some of the uses for the income that would be generated by the governor's proposed tax would be addressing the federal threats to SNAP and Medicaid. I have the amounts in my testimony, so I'm not going to read them all out. But that would include technology upgrades, additional personnel, and resources to help Rhode Islanders retain their benefits, support for the Rhode Island Community Food Bank, and a refundable state child tax credit. That proposal alone would address child poverty by putting $15 million back in the pockets of low-income families with children in fiscal year 2027 and over $30 million in fiscal year 2028 and beyond. I'm also here in support of Senator Murray's Bill 2238, which would raise the state income tax on the top 1% of earners. This legislation would make our tax system more equitable by making sure that our highest earners are paying their fair share. As we mentioned, Rhode Island needs additional revenue not only to make up for the harms of federal budget cuts, but to help families access reliable, affordable, and high-quality early care and education programs. Lisa took a lot of my stats, so I'm not going to repeat them. But we know that 9 out of 10 families can't afford the cost of childcare. With the federal affordability standard, families with 1 infant in childcare, that average center that pays staff close to minimum wage, they would need to earn at least $241,000 a year not to be cost burdened. If you have 2 kids, that's over $400,000 a year. She took that stat too. Sorry, I'm going to skip these so we can all go home a little bit sooner. In my written testimony, I've also shared some information about the state's eligibility for child care assistance programs, but the number in Rhode Island is so low, it almost looks like a typo in this graph. So we need to raise that amount so families can actually afford to go to work. There's no gimmick here. The needs are clear and real, the harm is imminent, and the solution is possible. Thank you for your time and consideration, and both Rhode Island Kids Count and the Right from the Start campaign urge passage of Senator Murray's Bill 2238. Thank you.
Michaela, thank you very much. Any questions or comments?